Hi, I'm Dr. Ben Beach, a dentist at Shreveport Bossier Family Dental Care. Today I'm at our South Shreveport office, which is located at 910 Burt Coons Industrial Loop. We're right here close to Kingston Road, right here on Burt Coons. So I just kind of want to let everybody know this is where we are. This is our building. I want you to come inside, see the facility, and get to know some of the girls we have working here. So y'all come on in. This is Gracie. She's the check-in girl here at our South Shreveport office, and she's the one that's going to be handling all the paperwork, helping you fill out your medical history, your insurance information, getting your insurance card, your driver's license, and all that kind of stuff. Gracie, as a new patient comes in, we like for them to get here a little bit earlier before their appointment to make sure that they've got time to fill out all their paperwork before they get called to the back, correct?
Yes.
How much time beforehand do we like our patients to get here?
Generally it takes about 10 to 15 minutes just to fill out everything, make sure that everything's filled out and correct.
Yeah, okay. So 15 minutes, okay, 15 minutes beforehand. And what's the pertinent information that we really need them to bring with them to the appointment?
Definitely your medicine list if you have anything like that, and your insurance card, and just make sure we have all your correct information and everything's up to date.
And driver's license,
yes,
and it's real important that the paperwork gets filled out correctly so we can actually put it in your chart. But anyway, so as you come in, you'll be seeing Gracie. She's going to take care of all the paperwork for you. And well, thanks a lot. Let's go meet some of the rest of the staff. So thanks.
No problem.
Hey Nika, how are you doing?
Good. How are you?
Good. This is Nika. She's our administrative team leader here at the South Shreveport office. She's pretty much a jack of all trades. She does insurance verification, and she does check-in, she does check-out, she does a little billing and insurance stuff. So, and she kind of heads up the group up here, and they've got an extremely good, well efficiently run department up here. Nikki, y'all always seem so collaborative, and y'all seem to have such good teamwork up here. How are y'all able to kind of pull together and work hard to make sure our patients are being taken care of?
Well, first we have a great group of girls. We all work together to make sure that our patients are our #1 priority. We always get all the information that we need to make sure that their visit is the most pleasant one. Whether it's checking their insurance, making sure we properly know what insurance what it pays. We try to get everything and put it in the system after our check-in ladies take care of everything, and it just kind of runs smooth.
And I know these insurance companies are always throwing curveballs at us, and I'm constantly seeing them getting on the phone with insurance companies, really trying to see what they'll pay for, what they won't pay for, and y'all seem to stay on top of that. And of course, none of it's a perfect science, but I know you got girls do the best we can to try to figure that out. But anyway, so when you come to South Shreveport office, you'll be seeing a lot of Nika and her staff, and so y'all come and see them. They love to take care of them too. So.
Absolutely. Whether it goes, Dr. Ben, with any type of financial problems, or if they do, we have a lot of different options. They can go in and see Mega, our financial coordinator, or we have different options that they can.
Sure. Okay, great. To make dentistry more affordable for them. Right. Great. Well, speaking of, let's go talk to Megan and see what she has to say.
All right.
Thanks. All right. Hey, Megan, how are you doing?
I'm good. How you doing?
Good. This is Megan. She's one of our consult room girls. She's a financial coordinator for us. She's the one that takes care of all the more in-depth treatment plans. She does financial arrangements, and she tries to make dentistry as affordable as she can for all of our patients. Can you get into that a little bit? What kind of financial arrangements do we have, or financial payment options do we allow here at our office? Or what are some of the things you do in here?
Well, we offer care credit here, and it's almost like a revolving credit line. And here, if you use it here in our office, we offer 6 months no interest and 12 months no interest.
Yeah.
We do have a membership club for our patients who don't currently have insurance. It works similar to insurance, except for we just give discounts off a treatment. You get your regular 2 cleanings per year, along with your x-rays and your doctor exams. And then, like I said, everything else is 20% off except for the whitening.
Sure, and that's got to be a really, and that's more for the patients that don't have insurance at all. They can join this membership club, and we're having a lot of patients take advantage of this.
Yeah, we are.
I mean, I think if you do the math on it, you get 2 free cleanings a year. If you just show up for your cleanings, you know, you've more than paid for itself by far.
Exactly.
So I know a lot of patients are doing that, and the care credit is, you know, up to a year with no interest. That seems like a really good deal there too. And we take most insurance company. We're providers for most insurance companies.
Yes, we are.
Yeah, well, good.
Yes, we
good. You know, once again, she's the one that's going to be the liaison between our insurance department and our patients, trying to make sure the finances are done correctly. You know, she's got a lot on her plate, but you know, her door is always open to all of our patients as far as any billing questions you might have, even treatment questions you might have. She's pretty much our patient care coordinator. She kind of does it all. So you know, we appreciate all the work you do for us, and you know, and all the support you provide for our patients. And so if you have any billing or insurance questions or treatment questions, she's your girl over here in South Shreveport. So well, thanks a lot. Let's go meet some more of the crew. Thanks.
Thank you. Bye-bye.
All right. Hey, Sherry, how are you doing?
I'm doing well.
This is Sherry Lewis. She's one of our clinical leaders here at our South Shreveport office, and she's been with us, what, 23 years? A long time. So she's seen and done it all. And you know, Sherry, you've been doing it so long with Dr. D's. I know one of y'all's biggest concerns here at this really all of our office is making sure that our patients are comfortable in a chair. And I know we do everything from, you know, provide pillows, provide blankets, you know, headphones, anything we can do to make their make their experience more positive. We're going to try to do it. Correct? Yeah. And I know for the right. And I know for the real nervous patient, we have a couple sedation options. Can you talk about those a little bit?
Well, there's 3 options. The easiest option for the patients when they come in that are nervous is the nitrous oxide, where we just have a little cone that we place over their nose, and they breathe in and out, and it helps them to relax during the treatment. And before we're done with the treatment, or usually at the end of the treatment, we put them back on oxygen, and they're able to drive themselves home after that. Yeah. But it helps them relax during the procedure to where they're, you know, just comfortable.
Sure. And then next we have the oral sedation. That's where the patient takes a little pill?
Right.
Yeah.
It's a prescribed medication that we give the patient the night before the appointment. And then they take it 2 hours prior to the appointment as well, and they have someone drive them to the appointment. It actually helps them to relax. They don't actually go to sleep, they just relax during the procedure, and it helps them, you know, to cope with it a little bit better. And it has somewhat of an amnesia effect that they don't remember a whole lot about it.
Yeah. And a lot of patients love that. It just helps them relax a little bit more. And then lastly, we've got the IV sedation, right? I know you've done a lot of cases with Dr. D's with that. And that's for the patient who's extremely nervous. And I mean, I've got patients who, you know, in the past, maybe when they were a kid, they had a really traumatic experience, and they are terrified to come to the dentist.
Yes, sir. Often we hear that, and that's the patient that really does need that IV sedation to help them.
Yeah.
It puts them to sleep for a short time. We get the treatment done. They usually are very thankful because they don't want to remember anything about it.
Yeah.
And then when they wake up, they have someone here to drive them home.
And I know y'all, you and Ross have told me y'all have patients that drive from all over North Louisiana just because we offer that service. Because not many dental offices do that. And well, y'all do a great job over here. I'm always so impressed when I come to this office with just how compassionate they are taking care of their patients. And
we take pride in taking care of our patients.
Right, and you know, of course, you've been with us 23 years, and you've worked at other offices before you ended up with us. What kept you here so long? What makes our office more attractive for you, you know, as a team member to stay here that long? I mean, that's a long time for anybody to be anywhere. I mean, what sets us apart from the other offices you may have worked at?
Well, haven't given a whole lot of thought. I just love being here every day. I love taking care of patients. Whenever I did become a dental assistant, I didn't know that was my calling, but once I did, I just love being here. We are very good at what we do.
Sure.
We take very
And
good
I know
care of
that we're very team oriented over
Yes,
here.
sir.
I mean, it is a bigger
a large
office.
team.
Yeah, it is a bigger office, but y'all got the small office feel, which makes people feel comfortable.
Yes, sir, we do.
And, yeah. Well, y'all do a great job. I'm always impressed when I come over here. So, man, y'all keep it up. Y'all are doing great, and
Every day.
and y'all pull together as a team, and you know, your number one concern is making sure our patients are taken care of.
Yes, sir.
And I'm always overly impressed with that. So
Thank
y'all are
you.
doing great.
Thank
So.
you.
All right, well, let's go check out. Let's meet some more of the crew. Okay, today I'm here with Dr. Milstead Fair. She's one of our doctors here at the South Shreveport office. And Doc, you work here what, Tuesday, Wednesday, Thursday, Friday?
Correct.
Are those your
here
days here?
4 days a week, Tuesday,
Four
Wednesday, Thursday,
days a
Friday.
week, yeah. And you've been a practicing dentist for 7 going on 8 years now, and you've worked at other offices. Now, you're doing, you know, root canals and extractions and you're pretty much doing it all, right? Restoring implants.
Right.
Yeah.
I've had experience doing everything, and I'm enjoying being able to treat everybody doing root canals, crowns,
Pretty much doing
fillings,
it. Sure.
whatever you need.
Whatever you need. And you know, I know you've only been with our office for a short time, though you have, you know, 8 years of experience. You know, compared to other offices you've worked at, you know, give us some feedback on the staff we have here that might be a little bit different than where you've worked in the past.
The staff here are extremely knowledgeable.
Yeah.
They are great with the patients. They know how to talk to them to keep everybody comfortable. They know exactly what I need when I need it. It's just
And
an
that's,
easy process.
Sure, and that's one of those things we really pride ourselves on, is making sure our patients feel as comfortable as we can. You know, and I know, of course, we as doctors, we're always meeting, collaborating, trying to get better as a group of practicing doctors. But you know, we also meet with the staff pretty regularly too, right? And you know, and any problems we're having, we're trying to get those addressed. And you know, our number one concern is making sure the patient's being taken care of.
Absolutely.
And collectively, we as doctors, that's our number one concern. And you know, our South Shreveport office is a little bit busier than an office, but if a new patient needs to get in, or emergency patient, is it pretty easy to get in to see you?
Yeah, we try to get them in as soon as possible. You know, if our schedule is tight, you know, our patients are our number one concern, and
We'll try to
get
squeeze them in,
Get
especially
in.
if they're hurting, or you know,
Absolutely.
I can't promise you we'll be able to actually treat you that day, but we're going to at least get you out of pain. And,
Right.
And once again, that's our main concern, is make sure our patients are taken care of. So, but y'all do a great job over here. I know we're getting a lot of rave reviews from you personally. She's already garnered a pretty large loyal patient following, and so girl, keep it up. You're doing great, and the patients seem to really like you, and Dr. Fair is very warm and calming, and she's a great clinician. So y'all come out and see her.
Looking forward to meeting everyone.
Thanks. Hey Lindsay, how are you doing?
Hey,
Doing all
I'm
right?
good.
This is Lindsay. She's one of our hygienists over here at our South Shreveport office on Burt Coons. And Lindsay, you've been with us quite some time. We're going on 7 years now.
Yes,
So
sir.
you've been here. You've seen a lot, done a lot over here.
Yes.
You know, today I just kind of want you to talk about the new patient experience. You know, as a new patient comes in, I know there's a lot of paperwork they fill out in the front, and then they come to the back, and that's kind of where you take over and clean their teeth. And can you tell us a little bit more about how that whole process works?
Yes. So I bring them back and go over all of medical history, everything. Get the patient's chief complaint, whatever your concern is our concern. Look at everything, do a gum evaluation, oral cancer screening, take a full series of x-rays to look at everything, and do your cleaning and just focus on what's bothering you. Then we'll go over a comprehensive exam of what we found and what needs to be done.
Yeah, and the doctor come in, y'all
Yes.
kind of co-diagnose
Right.
what's going on in there.
Right.
And you know, you said something that really sticks out to me here. of course, our concern is always our patient's concern. Our patient's chief complaint is what we're going to address first. And I know y'all do a very good job of forming a comprehensive treatment plan for our patients, as far as oral cancer screenings go, and I know you do the little probings to test what kind of condition the gums are in, and then of course you look at the hard tissue, the teeth, and see where your cavities are, what teeth might need root canals or crowns, or might not need anything. Maybe they just need a cleaning. But if our patient's concerned about a little chip in a front tooth, guess what? That's going to be a concern of ours, and we're gonna try to get that addressed and fixed. I mean, y'all do a great job over here, and y'all seem to make patients feel very comfortable. 'Cause I know sometimes the dentist office can be a little stressful place to be, but I know y'all got pillows in the rooms, and I know you got TVs up there, and I know y'all offer headphones too.
We do, and blankets.
Blankets, just anything we can do to make the experience with the patient, more comfortable.
Right.
One thing I've noticed about our hygiene department over here at this office is, man, y'all work so well together. Right? Y'all are very collaborative. Y'all are always helping each other out. If a patient needs something, regardless if you're seeing them or not, guess what? You're going to step in there and help that patient out, and y'all work very well as a team, and I'm always impressed about how much y'all help each other out, to achieve y'all's main goal, which is making sure the patient's taken care of.
Right.
Y'all keep doing what you're doing. Lindsay's a great hygienist. Y'all are going to love to meet her and let her treat you. She cleans a lot of my family members' teeth. My mother-in-law loves you, and even my wife, Dr. Katie, comes in and lets you clean her teeth. And she's a great hygienist. Y'all are going to love. We would love for y'all to meet her. So y'all come on and see her.
Come see me.
Yeah, good. Well, thanks for your time, and let's go meet some rest of the staff. So.
Thank you.
Now here we have Dr. Tate. He's one of the other doctors here at our South Shreveport office. He's from New Orleans, right? Yeah, New Orleans. He's been here a little over a year now, and we're getting a lot of rave reviews on social media about how great of a doctor Dr. Tate is, and our patients seem to really like him, and he's got a very calming demeanor about him, and he makes people relax and feel comfortable while they're in the dental chair. Now, Doc, you're doing root canals and crown. You're pretty much doing it all too, right?
Yeah, that's right.
Nothing you won't do. I know y'all are doing a big all-on-4 implant case the other day that, that was really impressive. You even had a little laser out that you were, kind of trimming some tissue back with, and I know that patient was real happy when they left. But is there, you are pretty much doing it all, correct?
Yeah, I'm basically doing anything that the patient really needs, trying to get in there and trying to do exactly what the patient needs to get. Nice, healthy.
Yeah, and I know, a big deal to us is to always address our patient's concern. I mean, in hygiene, or if we're doing a comprehensive exam on somebody, we're going to check everything out, but if you just got a little chip on a tooth and you're worried, well, guess what? We're going to do that, right?
That's absolutely
I mean, we're not here to push a bunch of treatment on anybody. We're going to tell you what you need, but we're going to give you what you want. And I know that you do a very good job of, once again, making patients feel comfortable. What certain things do we do here at our office that, you feel like really, empowers the patient to be a little bit more relaxed and, have a more positive experience?
For the most part, we really just kind of talk to them, really get to know them, that sort of thing. Make sure that they're as comfortable as possible before we do any treatment. They're the drivers of the bus whenever we do anything here.
Sure. And I know I always see your patient. We're always offering pillows and blankets and headphones, and we've also got some levels of sedation that for the real nervous patient who needs something a little bit extra to relax. But our number one goal is to make sure our patients are as comfortable as we can. And Doc, I know this is one of our busier offices that we have, but we can squeeze patients in anytime, especially ones that are hurting, right?
Yeah,
we really try to get them in, and making sure they're taken care of. Well, great. Y'all come see Dr. Tate. He's a great doctor, great clinician. The patients love him. So we would love for y'all to come in and see Dr. Tate, and he'd love to take care of you.
I'd love to have you.
Yeah, great. Thanks. All right, and now we're here with Dr. Dees. He's one of our anchor doctors here at the South Shreveport office. Dr. D's, you've been doing this, what, 30 years now?
30 years.
Quite some time.
30 years.
And now, Doc, you're doing everything, implants, root canals, you're doing, crown and bridge. You're pretty much a jack of all trades, right?
Yep. After 30 years, a lot of continuing ed, we try to do it all.
That's
full
right.
service here.
And Sherry, the lady that y'all met earlier, she is kind of his head assistant, and together she's been with you 23 years of those 30. And she went on just about how patient care and the positive patient experience and how to make patients feel more comfortable with us is a main priority of y'all's. And I couldn't agree more.
Absolutely, absolutely. There's just a lot that goes into our staff and the training, and they follow our mission. We're going to take care of people. You take care of people, and then we'll take care of your teeth. But we want you happy, we want you comfortable, and we just try to do the best we can.
That's right. And collectively, we meet as doctors and as a staff, and on a monthly, sometimes even weekly basis, just trying to get better, trying to figure out ways to make the experience, the patient experience more positive. Doc, if a new patient calls and has a broken tooth or is hurting, we can pretty much squeeze them in anytime, right?
Pretty much that day. That's our
Yeah.
goal. Try to take care of them that day. You call, you got a problem, somebody's gonna see you.
That's right. That's right. So once again, this is Dr. D's. He's been doing this a long time. We'd love to have you. Y'all come see him and the rest of our doctors, and our staff is ready for you. So yeah, y'all come see us. Thanks.
Come on.